Hey everyone, my name is Dr. Gayla T. S. Strong. I'm a physical therapist who got a 100% on my NPTE, and this allowed me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check us out at sptwithme.com for our NPTE prep courses. Now for what you're actually here for, let's answer the question of why do we need to know functional outcome measures? Ultimately, the reason why we bother to implement functional outcome measures is to provide proof that we need to keep our patients on our services. Now, who is this proof for? Well, first answer that probably comes to mind is insurance. We want to show insurance companies a justification of why our patient needs to continue physical therapy. Well, this outcome measure shows that my patient has a moderate disability, or this outcome measure shows that my patient is at a fall risk, and this one shows that my patient's quality of life is reduced. So all of these things show, at least initially, that we need to begin or continue therapy. Then, after a few sessions of physical therapy, we have them perform the same functional outcome measure, and this time it's used to prove that, yes, my patient is getting better, we did need therapy this whole time, and now they can be justified to be discharged because we met their goal. Another situation could be that at my next attempt at the functional outcome measure for my patient, it shows, yes, my patient is getting better and the score is higher or lower, depending on which one you use, because some of them, if they are lower, that indicates that we're improving. But in this case, unfortunately, the results have not met the goal. We are improving, but we're not yet at the minimal clinically important difference. So this kind of justifies that I am needing to keep the patient further. Another situation could be, oh no, my patient has regressed and they're declining in function. At this point, it's justifying that they do need to continue physical therapy services because now they're at a greater risk of falling, and now caregiver burden has increased. And there are populations and diagnoses that we do expect decline in, right? Parkinson's disease, ALS, these are progressive. So we expect them essentially to get worse, unfortunately. And in this case, it is appropriate to keep patients like this in order to improve their quality of life along with their family's quality of life. Another situation could be that my patient is staying the same, and sometimes that's a good thing, like with a maintenance program. I want my patient to at least maintain what they've got now. I check in on them maybe once a month, and hopefully at least we don't regress. There are certain populations for this as well. Another reason we should care about functional outcome measures is the proof that it provides to our patients. If they're not compliant with their HEP, you can show them the results of their functional outcome measure. After all this time, they haven't really made any progress. I wonder why. Now, some patients, they don't think they've improved, and this is a way that you can show them that they have. Maybe you're using it to prove that a patient's symptoms are mainly psychological. Let's say that objectively they're getting better and their balance is getting better and their strength is getting better, but their self-perceived disability is worsening. Sometimes that happens. And as physical therapists, as much as we want to provide them feedback about those kind of things, that's not necessarily within our scope of practice. And we can use this as a justification to maybe suggest for their doctor or for them to ask their doctor to refer them to another type of care in that case. Lastly, we can use functional outcome measures to our advantage to help us decide what to do next with our patient. We can use the results to maybe justify discharging a patient. This person has met their goal, they're good to go, they've met the MCID, the minimal clinically important difference, let's discharge them. Or maybe this person has not improved at all since the last time that the functional outcome measure was done. And reflect on this. Maybe we need to switch up the exercises that we're doing, or maybe we need to change our expectation of the realistic result of what our patient can get out of physical therapy, right? It's not always the patient's fault. Maybe it's a wake-up call for you to say, is it something that I'm doing? Could I have approached the situation a little bit differently? Always self-reflect. In addition, we can use the tasks that are on the outcome measure as a basis to consider our HEP off, or even the exercise programs that you do during the session. For example, we can literally have the tasks on the Berg Balance Scale be our HEP if we wanted. Functional outcome measures can guide us on what's important to focus on. It can help us ask the right questions, maybe questions that we either didn't think of or maybe forgot to ask. So essentially, all of these things are proving to insurance, proving to your patient and you yourself as a therapist that either things are going right or things are not going as planned. And just because things are not going as planned doesn't mean that you have to give up right then and there. We're always self-reflecting, which is okay. because every single patient that you see is different from the last. Everyone's learning in different ways. You just have to learn different personalities, different presentations, different styles of learning. But ultimately, functional outcome measures are incredibly important, and we need to care about them because they justify the need for physical therapy services for our patients. If you enjoy learning material in this way, check out our courses at sptwithme.com when you're studying for the NPTE.